You ever seen a lung scan? For most of us, it just looks like this. Crazy puzzle, right? All shades of gray and black. But for a radiologist, it's actually a mystery. And all the clues are hiding right there in plain sight. So the question is, how on earth do they crack that code?
So, when a doctor looks at a puzzle like this one, with all these little shadows and weird patterns, where do you even start? It's definitely not just a quick glance. No, it's a full-on, systematic investigation, kind of like a detective on a case. But what's their playbook? What's the instruction manual here?
Well, the secret is all about pattern recognition. Think of it like a step-by-step algorithm, a diagnostic playbook they follow every single time. So instead of just getting overwhelmed by all the details, they follow this really logical path. They make one decision, then the next, all based on these key patterns. And that's how they start narrowing down all the possibilities until, boom, the answer starts to come into focus.
The whole investigation, every single time, starts with one basic, super important question. It's the first major fork in the road, and it's this. Are the weird spots lighter, or are they darker than the normal, healthy lung around them? The fancy term for this is attenuation, and trust me, the answer to this one question basically dictates the rest of the entire journey.
And it's pretty simple, really. If an area looks whiter, that's called increased attenuation. All that means is it's denser than normal lung tissue. On the flip side, if it's darker, that's decreased attenuation. It's less dense. And that one decision, whiter or darker, splits the whole investigation into two totally separate paths.
All right, let's follow the first trail. Let's go down the whiter path. So we're now investigating cases of increased attenuation. This tells us that something denser than just air is filling up parts of the lung. The detective's job now is to figure out what that something is, and they do that by looking for its specific pattern. And on this path, our detective, the radiologist, is looking for four main suspects, or patterns. First, are they seeing little spots? Those are called nodules. Or maybe it's more of a hazy, fuzzy whiteness. That's known as ground glass opacity. Or is it a network of lines, which they call a reticular pattern? And finally, is it just a solid whiteout area? That's consolidation. Each one of these is a huge clue. Okay, to really get a feel for how this detective work plays out, let's zoom in on just one of those clues. Let's talk about nodules. Because finding nodules, that's not the end of the mystery. Oh no, that's just the start of a much deeper investigation. And you can really see the method here. Step 1, check the distribution. Where are these nodules located? Step 2, figure out the subtype. What do they actually look like up close? And then step 3, map that specific pattern to a list of possible diagnoses. It's a very logical flow. So, one of the coolest, most memorable patterns has this amazing name, tree in bud. And it looks exactly like it sounds. You see these tiny little branching lines that end in these little dots, almost like a bare tree in winter. And this isn't just some random shape. It's a literal picture of the tiny airways, the bronchioles, getting all clogged up with junk, like mucus or pus.
So you can imagine when a radiologist spots that tree and bud pattern, their list of suspects gets short fast. The number one culprit, the prime suspect, is almost always an infection, something like bronchiolitis or even tuberculosis. Sure, other things are possible, but that one single clue points the whole medical team in a very, very specific direction.
Okay, let's hit rewind. Back to that fork in the road. What if we took the other path? What if the problem areas were darker, not whiter? Now we're heading down the decreased attenuation branch. This means parts of the lung are less dense than they're supposed to be, usually because of something like trapped air or even destruction of the lung tissue itself. Down this road, our detective is on the lookout for two main patterns. Are we seeing a cystic pattern, think things like emphysema, or are we seeing something called mosaic perfusion? Now this one's a much more subtle clue, and it looks kind of like a patchwork quilt.
Mosaic perfusion is a really fascinating pattern. It seriously looks like someone laid a mosaic tile floor across the lung. You've got this patchwork of darker areas and lighter areas all mixed together. What that tells the doctor is that the blood flow, or perfusion, is all uneven. The real detective work, though, is figuring out why. And for that, the next clue is absolutely critical. So how did they crack this one? Well, they order a very clever test, a special scan taken while the patient breathes out. It's called an expiratory scan. Now, if those dark patches stay dark on the exhale, that's a dead giveaway. It means air is trapped, which is a massive clue for a small airways disease, like asthma. But if the lung starts to look more uniform when they breathe out, The problem probably isn't the airways at all. It's the blood vessels. I mean, how clever is that? That simple test is just a brilliant piece of detective work.
All right, so we've gone down both paths now. We've followed the light clues and the dark clues. We've seen how one pattern always leads to the next question. So now, let's pull it all together and see how this all leads to actually cracking the case.
And here's something really important to get. The goal here usually isn't to find one single final answer right from the scan. The real goal is to create what doctors call a differential diagnosis. Basically, it's a well-reasoned shortlist of the most likely suspects. And that list is what guides the other doctors on exactly what to do next, what tests to run to nail down the final diagnosis.
So this here is like the detective's final report. You've got the clue on one side, the pattern, and the list of suspects on the other. For instance, if they see a pattern that looks like a honeycomb, that points them straight towards fibrosis. Or if they see nodules arranged in a very specific way, that might suggest something like sarcoidosis. You see? The pattern is always the key.
So in the end, what starts out as this incredibly complex, kind of chaotic-looking image gets broken down, systematically, piece by piece. This whole methodical process of just recognizing patterns, it transforms that grayscale puzzle into a clear, logical path forward. It's really this amazing fusion of visual science and deep medical knowledge.
I mean, the techniques we have today are just incredible, right? They let us see inside our own bodies with this breathtaking clarity. And yet, it seems like with every single layer we manage to peel back, we just find new layers of complexity underneath. It really makes you wonder, are we just getting better and better at reading the code of the human body? Or can we ever truly, fully crack it?